Do I need an MRI for my low back pain? Holy cow, is this one I come across all the time. Worse, I see patients come in who have had an MRI or a CT scan for the low back that really there was no indication, no need. It was an absolute total waste of resources. Well, but it's just an MRI. We can't say the same thing with CT scans because they've been linked to some 29,000 cases of cancer per year because of the radiation dosage. But an MRI, it's just an MRI. There's no harm with it. It doesn't create a problem. There's some cost, but that was my insurance that paid for it. The reality is that people who have MRIs are more likely to have epidurals. People who have epidurals are more likely to get surgery. So in some weird, convoluted way, it changes our thinking as we relate to back pain, and we end up on a trajectory heading towards spinal injections and surgery, which is generally not a good thing. So to say that an MRI is benign, other than the cost, is not true. And we know pretty solidly from the research that that's a trajectory that it starts. The other thing that's a concern is there's very little correlation between what we find in MRI and what the patient presents with. We could line up 100 MRIs and 100 patients, and we can't connect that MRI to that patient and go, oh my gosh, this patient is going to have all kinds of low back pain. This one is not going to have any. There's no correlation. I have had patients who have massive low back pain and absolutely clean MRIs, and I've had patients with MRIs of the low back that are just destroyed and they have very little back pain. Couple examples, I've had patients who have gotten, I remember one had been under treatment for a year for a disc bulge. When she came in, she had no symptoms of a disc bulge whatsoever. Turned out that it was the hip causing pain down into her leg, and within 2 visits, that pain was entirely gone. There's been numerous times where somebody has what looks like a disc bulge, and we lift the leg up and it creates pain into the leg, but when we flip them back over, we loosen up the soft tissues on the back of the hip, we flip them back over, that is entirely gone, and clearly there was not a disc involved because I wouldn't be able to fix it in 3 minutes. So MRIs, more often than not, lead us down a pathway we don't want to go down. Personally, as much as I understand the value of MRIs and we can order them, I probably don't order more than a handful per year. It gives you an idea of how often I really need that information. And it's rare that I use that information on the front end. A good exam, a good history will tell me a great deal about what we're dealing with a patient. Even better, let me treat it for a visit or two, we'll see if they respond, and that becomes the best diagnosis possible, even above and beyond what we might get from an MRI. There are times that we've had an MRI either that we have ordered or from patient's primary care doctor that we look at and we go, oh my gosh, this is why you're not responding as expected, and we make treatment changes. That is far less common than me having to explain why somebody has some arthritis on their MRI or why there's a disc bulge but they really don't have any symptoms or signs that demonstrate that they actually have a disc bulge, and the disc bulge could have happened 20 years ago and it's still kind of hanging on, it's not causing any problems, but we order the MRI and we go, oh my gosh, that's your problem, you've got a disc bulge, we need to fix that.